this class of medication is actually not new. So they've been around for a long time. It mimics a hormone that we have in our body, and these hormones are called incretins. So incretins are what's produced by our gut and our stomach when we eat in order to handle the food that comes in. So primarily what it does is it causes our pancreas to produce more or secrete more insulin, therefore transporting the glucose and storing the glucose into our muscles and into our liver when we consume food. But this is a bit abnormal or not functioning as well in diabetics, and this medicine has been used in diabetics for a long time. So this medicine is not an incretin per se, but it mimics an incretin and lasts a long time, and therefore it's useful as medication. But along the way, people have found out that actually it has other actions as well. And it makes sense. Incretins actually help handle food, and to handle food, you need to make the mind feel full. At the same time, it also stops the food from going down the stomach so fast, aiding in mechanical digestion and breaking down of these food particles. And these new class of medications actually are more effective than previous class of medications, and most doctors, although not all, also think that it is actually generally safer than what we have currently in the market. So we have got liraglutide, we've got semaglutide, and semaglutide is probably the one of interest right now, which most people are most interested in. And studies have shown that for semaglutide, after 1 year, the studies have shown that most people lose about 18% of their body weight. With even 5% weight loss, you start to have health benefits. And at 80%, a lot of people, especially who are very overweight, do experience a lot of health benefits in terms of their knees, in terms of their kidneys, in terms of their heart, in terms of their brain, and generally in terms of their general well-being. And this is even more remarkable in that a third of these patients actually lose more than 20% of their body weight based on studies. So that's one innovation. And further medication and the further innovation on this is a new medication called tirzepatide. And tirzepatide is actually analog of two different incretins. A lot of doctors think that by having a dual mechanism of action, both targeting incretins in a slightly different way, you have a more effective treatment with less side effects. But the verdict is still out there. So for the people who actually need it, these medications are really very effective and very safe, and leads to a lot of health benefits, either then or later on in life. So therefore, I think it's still important for us to look at weight on top of just really good something. But having said that, I think these two treatments go hand in hand because generally people who have stubborn bulges and need some form of body contouring like good sculpting will also benefit from the weight loss, and also vice versa.
I see.